now.
Hello everybody, my name is Pamela Barnes and I'm giving this interview to help people about their health issues. Me too, I hope.
Thank you, Pamela. My name is Katie Brady. It's August 16th, 2012, and I appreciate you taking the time to provide us with your feedback and your input.
Oh, that's fine, Katie. I'm at your service here.
Now, if I may ask, how old are you?
No, you may not ask, but misusal has something to do with it, and I'm old enough to be on Medi-Cal, all those things.
Okay. Where are you from?
Well, originally England. And do you want specifics?
Sure.
Well, I grew up, well, it was Mr. Hitler's time,
Okay.
you see.
Time out. Don't need that much.
Don't worry
Sorry.
about the details.
Okay. Where in England?
Well, that's what I was coming to.
Oh, okay.
See, you interrupted. Well, anyway, it was Mr. Hitler's time, and so there was a thing called evacuate the children, therefore I was in London, and so I got evacuated. First to Wales, where I nearly died and caught measles because it was so primitive. They were practically living in caves, and I'm deaf in one ear as a result, permanently. And then, parents realising they made a horrible mistake, I then got sent to Shropshire, which is bordering Wales, but it's in England, and it's very beautiful. You can go online and look at Ludlow, which has a castle on the hill. It's very beautiful, and I grew up there until I was of grammar school age. Then I came back to London, where I went to high school and university. That's it in a nutshell.
When did you come to the United States?
Well, after university and a few other things, I won a scholarship to travel, and I got a job in Boston, because the scholarship wasn't very big, but I got this job in Boston in a printing shop. Little did I know that the boss had 9 sons. Oh, boy, was that a headache. Can you imagine driving off 9 sons when you're in your mid-20s?
No, actually.
I had a very hard time till I escaped. Went to New York every weekend, and guess what was happening there? Gay people were beginning to assemble in all kinds of corners, and in those days you had to, when you went to a bar, you had to knock on the door, and the little door would open just like a speakeasy, and you would have to identify yourself. And I would show my passport, which in those days was very handsome, with, you know, gold insignia and everything, and they thought that I was FBI, and they wouldn't let me in at first. Anyway, finally a friend escorted me, and I would get in the bars, and that was just the prelude to, guess what? Stonewall! Ta-da! So now you know what the date was. That's if you remember your history. 1969.
Okay.
Ha ha! We all got out there and we marched down 5th Avenue along with other things, and people would lean out their windows and say, "My God, who would have thought there were so many of them?"
Yes.
So that was a good day.
So when you got to New York, or when you were in New York, what was your occupation?
I was in New York for 15 years, and I did many, many, many things to earn some bucks, and well, like market research and other junky stuff. But in between, I would broadcast on the radio, and I invented this program called the Mary Flowerpot Show. Ta-da! Which everybody so enjoyed. I got fan mail at the wazoo, because I had always, you know, I'd always grown up with radio. I'd never seen television until I was in my, I think, late teens, early 20s. We never had television, if you can imagine that. Anyway, we used to have these marvellous radio programs. Absolutely marvellous radio programs. Round the Horn and Tommy Hanley and this and that. Anybody who knew anything about radio history would know these things. Anyway, so I had developed apparently what was called a good head. So I would write these scripts about the adventures of Mary Flowerpot and broadcast them with sound effects. I went out and got a whole set of sound effects and threw in all these sound effects. We had great times, great times. I loved New York. New York's one of my favourite cities.
So when did you come to California?
Oh, when it just got too bloody hot in the summer and too damn cold in the winter, which was most years.
And
I can't stand it anymore. So I got to be going to Maine in the summer, beautiful state, and sit under the cool fir trees, and down to Florida in the winter among the Everglades swamps. And somebody said to me, I don't know why you keep going somewhere for 3 months here and 3 months there. Why don't you just go somewhere where the weather is better for you? I said, like where? And they said, well, San Francisco. Oh, okay. So I get on a plane and come to San Francisco. That was it. That was the end of New York.
When was that?
Oh, I don't know.
The 80s, 70s, 90s?
No. Somewhere in the 80s, somewhere.
Okay.
I forget. I don't remember dates.
No worries.
Except for history, but not my history.
There we go. So what did you do
So depressing.
prior to, what work did you do when you got out here?
Oh, well, I missed out an episode of one of the things I did and made a lot of money in New York. Once when I was at university, my professor wanted his Victorian house wallpapered, and the guy who'd been hired to wallpaper had broken his arm. So Ted said, well, it's not really that difficult, I'll show you what to do, you do it. I said, okay. So I started doing this wallpapering. Well, when I came to New York, I put an ad in the Village Voice, because by then I got good, right? Mother's Wallpapering Empire. Boy, I got so many calls, I had to go away to Long Island for a rest. It was wonderful. I would go around to people's houses and there would be the wallpaper and a key to the door and a check and the, open fridge and wallpaper. And I made all this money. It was wonderful.
All right.
So when I came out here, nobody wanted wallpaper. Far from it. They just wanted to paint everything white. No wallpaper. Oh, well, that's no good. I have to think of something else. So I did. Because really I write. I mean, that's really what I like to do. I write plays. I write musicals. And if you want to see one, go on YouTube and punch in Josephine the Pirate Queen, and you'll see the latest one that was produced at the Knox Theatre in Contra Costa. And I write the book, which is the plot, the text, and the lyrics. That's kind of like the songs without the music. So I work with this wonderful friend, Ellen Hoffman, who's a brilliant musician and composer, and we work together on a stupendous program for the computer called Sibelius, which has every instrument you could possibly think of. So we write the music.
Okay. So what were you doing before you became, before you were able to work?
Oh, you see, well, I would pick up jobs everywhere. And the last job I had, just to get to your point quicker, was going around to people to tell them about solar panels. It was out of Walnut Creek. And you could make some good money doing that. And then, one day, this was last year, the end of last year, I suddenly noticed I was showing, and I thought, oh my God, what is this? My age? Oh no, this can't be. So I immediately ran to the doctor and he said, uh-oh, better go to a specialist. I did. I went to several. And by the time I ended up having, let's see, 3 biopsies, the last one being a deep biopsy under anaesthetic, because at first they thought, oh yes, well you've got a stage 1 cancer of the cervix. Oh my God. And then by the 3rd biopsy it was stage 2. So I said, well, we better not waste any more time, had we?
Yeah, still cervical cancer?
Cervical.
Okay.
They said, operation's out, it's got to be chemo and radiation. Oh, crumbs. It was terrible. Absolutely terrible. I can't tell you how terrible it was. I just told your partner here how terrible it was. It was worse than the shock of showing at my age. Because I hadn't felt anything bad, really. Well, a sort of slight grumbling. But by the time I'd been through the torturous treatment, however, I should be thankful. In the old days, people died from this sort of thing. Too sweet. And here I was battling on with daily radiation and chemotherapy. And my friend, Ellen, no less, said to me, because here I live out in San Pablo, and there's a hospital down the road. She said, don't go there. Go to the one in Berkeley. I said, oh, Walter Bates. That's the best one. Go there. I said, all right, whatever you say. So I did. And she was right. I had marvellous treatment, I have to say.
So how would you describe your current health issues and how does it affect your day?
Well, here we are now in August, and all this started in January. It's been a long, long time going through the complete alimentary upheavals of every kind. A port being installed in my body so they could draw blood out of me, and so on and so forth. I won't bore my listeners with the ugly details, but suffice to say that my whole alimentary canal was in revolt, and I had the most ghastly taste in my mouth all the time. I couldn't even think about food, much less eat any. Lost umpteen pounds of weight, which I'm not grateful for, because I wasn't overweight to start with, but now I'm like a shriveled prune in various parts of my body I'd rather not mention. So gradually I'm increasing my food intake. Like I have a boiled egg at breakfast with 1 slice of toast, and then a month later I up it to 2 slices of toast, and so forth. So it's been slow.
And strength, ability to go
Right.
out to work?
Well, my mojo is definitely not regained, but very gradually I'm getting a little more energy so that I don't have to do just one thing and then go to bed. I can do 2 or 3 things and then go to bed.
So how do you get your health care?
Oh, well, mercifully, with all my dilly-dallying and shilly-shallying, I got Medi-Cal and Medicare, and I never know the difference between the two. And so when it came to, you know, facing ghastly bills for, I didn't have to. And I got a beautiful certificate for going through the whole course of radiation of 6 ghastly weeks. And then I had to go to San Francisco for 2 more to be shot up the wazoo with tubes and injected with radiation. I don't recommend any of this to anybody unless, as my doctor said, do I have to do that. I'm just so tired of radiation. And he said, do you want to die? Patrick, he's very sweet. Well, not just yet. Well, go to San Francisco and have it done.
So how did you get to San Francisco? How do you get to the doctor?
Friends would drive.
Friends would drive. Okay. So what
rescue me as I came back, wilted, exhausted, and the food in the hospital was dreadful. Not that I was even in the mood for eating anything, but I couldn't believe how ghastly it was. I thought it couldn't be any worse than this if I went to prison. Not that I've ever been there yet, but...
Okay, so what do you think works well about our healthcare system?
Worthwhile?
Works well.
Oh, works well. Oh, well, all the doctors and everybody at Berkeley and, the staff. Except one person. I just came across one really when I was very late to get out of radiation. She was so grumpy, she threw my coat at me and, well, she was in a bad mood, that's for sure. Anyway, aside from her, everybody was just wonderful. And so competent, the doctors and the surgeons. They only made one big mistake. I'm very, very sensitive. And because I don't smoke and I don't do sort of disgusting things with my body as a rule. And they OD'd me on some anaesthetic and I went bonkers. It was really weird. That was when they were going to put the port in. I went bonkers. And they got it right the next time when they had to take the port out. But that was the only big thing that happened. Otherwise everybody was wonderful.
What doesn't work?
In what?
In our healthcare system. And
how you get your healthcare? What's not working for you?
What's not working for me in the healthcare system?
And what services maybe you would like to get?
Okay. There's way too much bureaucracy and paper filling, and most of the nurses spent, I'd say 80% of their time filling out bits of paper that they could hardly hear you when you said pen or something or other. And it's bureaucracy up the wazoo that, you know, one does not appreciate from any point of view. And not only do I have to fill out everything, but they have to fill out everything, and so on and so on and so on. So that's really, you know, I don't know who reads all this stuff, if anybody ever does. But anyway, that's not a good thing. The other thing about it is, you see, I'm used to the NHS. For those uninitiated, that's the National Health System that they have in England. And that people have recommended, that, I think they have it in Canada too, that it be here, but because of the politicians and the dreadful way that politics are run in this country, that doesn't seem to have got off the ground in any way, shape or form, which is too jolly bad because it really works in Europe. So when I came to the States, I was really amazed at how in some parts of the society, they're so fond of reinventing the wheel that they can't think of how good it is somewhere else and use their system. This would be a shining example.
Would you have had the same access to the physicians and the chemotherapy and the care? Would you have?
Absolutely. I can't complain one iota about the medical profession at all. They were marvellous, all of them, everyone. Nurses, doctors, assistants, everything.
I meant in relation to the English system versus over here. Would you have had the same access to the care that you got because of your age or whatever? Would they have given you the same chemotherapy treatments and radiation and all of that you got?
Absolutely. Absolutely. Okay. Because I'm in correspondence with people in England and people my age, who've had to have various medical things happen, and so I know the details. Now, the real bad part about this whole system I'm coming to. Whilst doctors here are very good, and probably it has to do with people owning guns and all that and war, they're very good about your physical stuff when it comes to your actual, tearing apart of the body. They're not nearly so good when it comes to alternate practices of a medical kind, such as acupuncture. Well, one can go on about all kinds of alternate methods of treating health, including Chinese systems and so forth. There are other ways to go, but this country is totally committed to just treating the whole physical body like it's a sort of, single parts of an organ, and not nearly so well holistically, including the food, which I've mentioned already. Never mind. But there's another area, a whole giant area, which I'm really wanting to complain about, because now I've reached the point when I need it. There is nothing for dental, nothing for visual care. Nothing. You would not get this anywhere else that I know of. If I go to the doctor, for the dentist rather, I get handed a giant bill. If I go to the optometrist or ophthalmologist, whatever, I get handed another giant bill. There's no relief. And us folks who are, various parts do wear out, like the eyes and teeth, you need that just as much.
Okay. Are you aware that there are soon going to be changes in services and that you're going to be enrolled in a managed care plan?
Oh! I think this is where I emigrate to Canada or England or something. I can't even begin to think about that.
Okay.
I can't.
What are your concerns about that?
Being handed large bills I could possibly pay. I mean, there's talk of this, you're just going to get a voucher. Well, what the hell good's that going to be if it comes to something really expensive? Like 10 weeks of chemotherapy and radiation? Oh no. I mean, it can't even deal with my teeth and my eyes, much less, deal with going through a voucher system.
So if there were no additional costs to you, what would concern you if cost were not an issue? If you didn't have to pay any more out of pocket, is there anything about the idea of a managed care service that would concern you?
I don't really know what this whole managed care bit means. Okay. I'd have to know the details before I could say anything constructive about it.
Because I'm thinking, like this voucher that you brought up, the voucher would demonstrate that you are eligible for the services. You then have a choice between a managed care plan that's managed by Alameda Alliance for Health or one that's managed by like a Blue Cross of California. And then you would pick one or the other.
All right. Now, you're talking about insurance companies.
Right.
Oh, well, now there's another bugaboo I'd really like to dig into. But, geez whiz, I don't know how long a session you want here. Oh, I can't even stand the prospect of insurance companies entering into this fray. I really can't. And I'll tell you why. When I wasn't employed at one point, and I asked for an insurance coverage, I was shocked at the premium. It was like $650 a month or something. I said, oh, forget it. I mean, I pay less for my rent, my living quarters, than you're asking me for a premium for. I mean, car insurance is bad enough. Any insurance, I think the whole insurance business is like, you know, Lytton is down the road here. A horrible, horrible place where people gamble. I'm sure you know all about the casinos and why the Indians thought that was a good solution to their problems. I don't know, except they could rip off us pale faces. Well, anyway, I hate the casinos. I think they are on a par with insurance companies. And there you have it. I would no more go into a casino than step voluntarily into my coffin. That's what I think.
Okay. If you could speak to a public official about these potential changes that may be coming?
Well, I think if you just join this interview, it'll become clear where I'm coming from.
So would you say your biggest concerns are just the services that will be made available to you? Maybe afraid that there will be more bureaucracy than less?
Or the